Colorectal cancer is on the rise in younger adults and is the second deadliest cancer in the United States. That's why medical guidelines recommend screening at age 45. But our next guest thought he could delay his screening.
My father-in-law died of stage 4 colon cancer 6 months after being diagnosed. So when I turned age 50, my wife and my doctor insisted I get screened. I felt healthy and I didn't want to do it because I was apprehensive about having a colonoscopy. Because I was average risk, my doctor suggested an at-home DNA stool test. I did the test, I sent it in, and to my surprise, the results came back positive. After a confirmatory colonoscopy, I was diagnosed with colorectal cancer, which I later found out was stage 1.
Scott is joining us today via Zoom. Thanks, Scott, so much for being here.
Thank you for having me.
Pleasure. So, Scott, tell us what happened after that diagnosis, and more importantly, how are you doing now?
Well, thank you for asking. I had 12 polyps and 18 inches of my colon removed. But since then, my follow-up evaluations have thankfully come back with no signs of cancer.
Scott, congratulations. That really is great news. We're so happy for you.
Thank you.
Also joining us today is Dr. Angela Nicholas. Now, Dr. Nicholas, you have both a professional and a personal connection to this disease. Can you tell us about that?
Yes, I do. My husband, John, was diagnosed at age 45 with colorectal cancer, and he passed away when he was 50. So I'm here today to raise awareness about colorectal cancer screenings. Colorectal cancer is considered preventable, and when caught in early stages, is treatable.
You know, Dr. Nicholas, so sorry to hear your loss, losing your husband at such a young age. So difficult. That's why we're talking about it today. And, you know, many people don't experience symptoms in the early stages, but in some instances, there are signs or reasons to believe you may be at higher risk. If you experience prolonged diarrhea, constipation, narrowing of the stool, rectal bleeding, blood in the stool, cramping and abdominal pain, fatigue, or unintended weight loss, make sure to talk to your doctor right away. So, Dr. Nicholas, explain to us what happens exactly in the body with colorectal cancer.
Most colorectal cancers begin as a growth in the lining of the colon or the rectum called a polyp. If a doctor sees a polyp on colonoscopy, they'll remove it and send it for biopsy. That biopsy will determine whether it is benign or cancerous.
You may be at high risk if you have a family history of colorectal cancer, adenomas, and other related cancers, or conditions that place you at high risk for colorectal cancer, such as inflammatory bowel disease, ulcerative colitis, or Crohn's disease. You know, there's multiple ways to get screened, especially if you're at average risk. So important, Dr. Nicholas. Let's talk about that.
Absolutely. One method is a colonoscopy. A doctor inserts a scope into the colon and rectum while the patient is sedated.
Unfortunately, the COVID-19 pandemic has led to a substantial decline in cancer screenings because many people are just staying away from medical facilities.
That's really a huge problem right now. But the important thing to know is that you can be screened at home using a stool-based test. Now, if that test is positive, you will need to have a confirmatory colonoscopy. And that's why I'm here today on behalf of Cologuard. Cologuard is an FDA-approved, non-invasive, at-home screening test. It is effective and convenient and indicated for those who are 45 years and older and at average risk for colon cancer, not high risk. Cologuard does require a prescription. It will be delivered to and from your home, but here's the great part about it. Does not require any time off from work, does not require a colonoscopy prep, and does not require you to change your diet or medications prior to the test.
So, Dr. Nicholas, tell us, how exactly does Cologuard detect colorectal cancers?
Cologuard finds 92% of colorectal cancers by detecting abnormal DNA found in colon cancers or blood in your stool. You should talk to your healthcare provider or go to Cologuard.com.
As Dr. Nicholas mentioned, as always, make sure to talk to your healthcare provider about what is right for you. Scott, thank you for sharing your story that ended with a very happy ending.
Thank you very much. And I hope my story, my experiences will help anyone considering getting screened for colorectal cancer.
I'm sure it will. And Dr. Nicholas, thank you for being here as well.
Thanks so much for having me. I appreciate the opportunity to talk about colorectal cancer awareness.
Thank you. Don't go away. There's more to come here on The Doctors.